Good evening, everybody, and welcome once again to this edition of Ask the Expert brought to you by Numen Health. Today, we have with us Dr. Dhiren Shah. He's the Director of Cardiothoracic and Vascular Surgery Department at CIMS Marengo Hospital in Ahmedabad. Welcome to the show, sir, and thank you so much for taking time out of your very busy schedule to spend some time with us on this show. So at the outset, we'd like to listen from you a little bit about yourself and what you do, and more importantly for the audience, why did you become a cardiothoracic surgeon? So a short introduction about yourself, and then what was the passion that made you a cardiothoracic surgeon, sir?
So I am Dr. Dhiren Shah. I am Director of CVDS Department and Heart Transplant Unit at CIMS Marengo Hospital in Ahmedabad. And the CIMS Hospital, I am also the founding director partner of this hospital. And we built this hospital in 2010. And now it's 450 bedded hospital. One of the green hospital that we have built in last 10 years back. Oh, now coming to the whole team that we have at our place. When I started my career as a cardiac surgeon, I had a dream of creating a hospital or a cardiac surgical unit wherein it has to be a one-stop solution center sort of thing. And over a period of last 20 years of my journey in cardiac surgery, I can be happy and delighted to share with you that we have been able to create this one-stop solution center at Marengo CIMS. So be it a one-day child or a 90 or 100-year-old gentleman, or be it a normal heart function or a failure patient or a heart transplant patient, we treat everything at our own place. So it's a place where you can get a treatment for simple surgery also, to a heart transplantation, to a artificial heart also. I have a team of 6 cardiac surgeons, 4 cardiac anesthetists, 4 perfusionists, and 5 intensivists in my team. So, and along with that, in a cardiology perspective or cardiology side, I have 2 cardiologists in the team. So we work as a single combined team. An important thing is whatever decisions that we make, it is always a heart team approach that we are doing for, so that you can give the best to the patient and give the ethical guidance to the patient. Regarding my passion, obviously मैं जब छोटा था तो बचपन में काफी सारे हार्ट सर्जन के बारे में सुनता था. At my place, people used to come, okay, today I got my bypass surgery here and this is a great surgeon. And so right from my childhood, before even I entered my MBBS, I was very clear that I wanted to be a cardiac surgeon. So I think so I've never thought of anything else but just to be a cardiac surgeon. So that is where I'm here, sitting before you, discussing with you, being a cardiac surgeon now. So it was a very glorified branch, but at the same time, one of the most toughest branch also.
Yes.
You have to put in not 100% but 300% in your efforts.
Yes, thank you, sir. I think that's a very inspiring story to hear from you. And I think the point that you mentioned about comprehensive cardiac care, that one center a patient can get complete care. I think that vision of yours is something very important. And for us to kind of tell to the world, our audience out here, what all types of surgeries generally happen on the heart? Can you just elaborate broadly? What are the different types of surgeries that a person can have with the heart as an organ for it?
So see, look at if you broadly divide cardiac surgery, then it can be divided into 2. One is the pediatric cardiac surgery, so surgery on heart done on the pediatric patients, and the second is the adult cardiac surgery. So broadly, you can divide it into 2. So in pediatric age group, it is more of a congenital anomalies, या जो जन्म से ही आपको तकलीफ है हार्ट के अंदर, जैसे होल है या एक्स्ट्रा नली है या हार्ट की जो रचना है वो एबनॉर्मल है, तो ऐसे सब पेशेंट्स की पीडियाट्रिक कार्डियक सर्जरी होती है, जिसमें एक दिन के बच्चे को भी जरूरत पड़ सकती है, and even adult patient also may require congenital cardiac surgeries also. So now coming to the adult cardiac surgery. Adult cardiac surgery is a huge spectrum. So from the bypass surgery, which is the most common surgeries which is performed world over, one is the bypass surgery कि जिसमें नलियों में ब्लॉक आता है, हार्ट अटैक आता है, वो पेशेंट्स का हम बाईपास सर्जरी करते हैं. सेकंड है वाल्व है, हार्ट के अंदर जो आप देखेंगे तो हार्ट के अंदर ये वाल्व्स होते हैं, तो ये वाल्व्स में भी तकलीफ हो सकती है, तो ये वाल्व का भी हम ऑपरेशन करते हैं. ये महाधमनियां जो होती है इसमें कुछ डिफेक्ट आ जाता है तो उसकी सर्जरी करते हैं हम. हार्ट फेलियर सर्जरीज होती है जिसके हार्ट कमजोर हो चुके हैं फॉर वेरियस रीजन, तो उसके भी बाईपासेस, उसके भी वाल्व रिप्लेसमेंट, उनकी पेरिकार्डिक्टोमी सर्जरी, ये सब हम सर्जरी करते हैं. और कई बार ऐसा होता है, and many times I would say कि when the whole heart becomes very weak and then you don't have any other option for the treatment, then in that case scenario we do heart transplantation also. And in few cases wherein heart transplantation may not be possible, then definitely you have artificial hearts also available. So we even do artificial heart implantation also at our center. So we practically deal the whole spectrum from normal bypass surgery to a heart transplantation and artificial heart. And even in bypass surgeries and valve surgeries, you have minimal invasive surgeries also, you have beating heart surgeries also, then you have valve replacement without surgery, that is a TAVI procedure, that is very well known and everybody is aware. तो वो भी procedure हम करते हैं. So in short, we do practically everything at our place.
Thank you, sir. And I think it is quite interesting to hear that the whole spectrum of cardiac surgery is expanded so much. During our days when we were students, I think the only thing that we used to hear a lot about was on pump heart surgery, on pump coronary artery bypass grafts. I think right now people have gone into this off pump or beating heart coronary artery bypass surgeries. Can you elaborate a little bit on these two aspects and throw us also a little light on this whole concept of microsurgery in heart surgery? So on pump, off pump, and microsurgery, so that our audience are able to understand that in bypass itself there are different types of surgeries.
I think so, very important question. And one of the most, I would say, a lot of myths and facts are there around the bypass surgery issue. So, for example, when you talk about bypass surgery, people always think bypass surgery is just bypass surgery. But let me tell you, bypass surgery can be done in a lot different way. So, if you look at how it was done initially, then initially it was the routine bypass surgery wherein the heart used to stop, then a bypass graft was done, and then again the heart was started. So that is on pump surgery. Then came the development of beating heart surgery. So wherein heart is beating, your pulse and BP is normal, and then you do a bypass surgery. So that is beating heart surgery. Then came an advancement of total arterial bypass surgery, means the conduits that you are using, conduits. So whether it is internal mammary artery, so artery from the chest or artery from your hand or this. So this arterial bypass came, so bilateral mammary and radial artery. So these are the arterial because you get a longer duration of durability in that. So that is why total arterial or multi-arterial bypasses came. Then came an era of minimal invasive. So mid-cap or minimal invasive or mini bypass surgery, wherein Instead of doing the surgery from the chest in the center, you put a small incision on the left side between the two ribs, just a 3 or 4 centimeter size, 4 inches length incision, and then you can perform a beating heart surgery on the heart. So minimal invasive or mini bypass is also possible now. Apart from that, initially it was thought if your heart function is weak, if your ejection fraction is less और आपका हार्ट कमजोर हो चुका है तो बाईपास नहीं हो सकता है. तो ये भी आज के टाइम में आप देखने जाएंगे तो जिसका 15%, 20%, 25% भी पंपिंग होगा तो उनका भी बाईपास हो सकता है क्योंकि अभी एडवांस टेक्नोलॉजी आ गई है और उसकी मैनेजमेंट भी आ गया है. एंड another very important thing is since last 5-10 years पहले के जो बाईपास हो चुके हैं उनको वापस जब ब्लॉक आते हैं तो उनके लिए रीडू बाईपास, दोबारा का बाईपास, वो भी अभी पॉसिबल हो सकता है. सो अभी अपार्ट फ्रॉम द रूटीन बाईपास इवन रीडू, एक बार नहीं 2 बार भी बाईपास हो सकता है, 3 बार भी बाईपास हो सकता है. सो आई थिंक सो दिस इज द होल evolution of a bypass surgery from on pump surgery to a beating heart surgery to a minimal invasive surgery. You're on mute, Dr. Albin. Dr. Albin, you're on mute.
Sorry. So I was saying that this is very well explained to our audience, and important that there's a lot of confusion that people have, and I'm sure you also as a surgeon will be getting patients coming to you with all half-baked information. What do you do to educate the patient and the family when you decide to do a surgery? Are there any specific kind of pointers that you have been able to use to convince somebody about going in surgery? Because the whole decision of going into surgery can be sometimes quite anxious moments for the patient and the family. So can you tell us a little bit about how you manage the expectations of the patient when they come to you with an option for surgery?
I think so, very important point. And as you mentioned, there are a lot of half-baked stories that these patients they have, and half they hear here and there from there, and then they assume the things, and then the issues are there. So, very important message to be given to the audience is you should get your surgery, a bypass surgery, in a center which can perform this whole spectrum of surgery. So, what happens is, if in a particular patient this is better, that will be done. In a particular patient, minimal invasive is better, do that for that patient. So I think so now is an era of tailor-made surgery. So for that particular category of patient or that particular patient, if this is the best option, we do surgery in that way. In that patient, other patient, if that is the best option, we do that surgery in that way. So important thing is go to a center where the center is performing the whole spectrum of bypass surgeries or cardiac surgery so that you get the best that is suited for you. Another very important point that you raised is when the patients they come for the cardiac surgery, obviously the taboo is there. Cardiac surgery, open heart surgery, bypass surgery, my God, patients they don't live. It's a very big surgery. So first and foremost thing that I tell them, everybody, if your parameters are fine, if your overall, you don't have any risk factor, then the risk of bypass surgery is as good as any other gallbladder surgery or abdominal surgery or any other surgery. So it is in the range of 2 to 3% or 5%. So that is the only risk factor that you stand for doing a bypass surgery. Because unfortunately, people assume that it is 50% mortality or 80% risk factor is there. So when you tell them that this is the risk factor, I think so half of your job is done. Then what you have to make them understand is how the progress would be. What is going to be there in next another 4, 5, 6 days that you are going to stay in the hospital. So if that understanding or that message or that things are clear in the patient's mindset, then it becomes very easier for the patients to convince them for the surgery. So for example, if I tell them, patient, after surgery on third day, you will be walking in the lobby, you will be sitting on the chair, you will be doing exercise, that itself reduces their stress level significantly. So I think so there are various ways wherein you can have to deal with the patients with the various questions also during your consultations.
Thank you, sir. That comes from a lot of experience, and I'm sure just to summarize what we've been discussing so far, for people who may have joined right now, what Dr. Dhiren Shah has been explaining is that there is different types of heart surgeries that get done, and a center that is equipped with ability to solve all the problems is the right kind of center to go for your heart surgery. And when it comes to bypass surgery, which is one of the oldest heart surgeries that is known to mankind, there is now a lot of evolution from on pump to off pump beating heart to arterial bypass grafts and now to minimally invasive surgery. But the choice to do which surgery depends on the patient and the doctor choice looking at patient's health and the status. So it is good to go to a center where you can have all these choices and take the right choice which is best for you. I think that's the summary of what we've been discussing so far, and Dr. Dhiren Shah has been explaining it very beautifully to all of us here. Now going to another element of entire aspect of a surgery. Now the patient also, now he has taken the decision to undergo the surgery. Then the next point that will come to them is what to expect in the recovery period. How soon can they get back to work? How soon will they be able to? You already touched upon it. You convinced them that they can start walking the next day after 2 days. They'll be sitting up on the bed very soon. So that bit of it is within the hospital. What does patients? What kind of expectations do patients have? In your experience, I'm sure you must have come across a lot of people coming with different types of expectations. What is the general kind of concern that people have when it comes to recovery after a surgery? Because that's one big concern. People think, oh, I have a very long period of recovery. I don't want to go through that entire long period of recovery. So, how can you explain that to our audience?
I think so. Very important aspect that needs to be dealt with and that needs to be discussed among the society, because that is where the issues are, and that is where the people have that wrong beliefs and myths regarding the cardiac surgery or open heart surgery. I would say in the present scenario and in the present science and technological advancement that we have, the recovery process in cardiac surgery after bypass valve surgery is very fast now. I would say when the patient comes to me for my consultation, the whole process that I make them understand is the day before surgery you get admitted, your investigations will be done. Next day surgery. Now the main concern about the patient is कि जब हमको ऑपरेशन थिएटर में लेके जाएंगे हमको बहुत घबराहट होती है, हमको डर लगता है, ये सबसे बड़ा क्वेश्चन आता है, डर होता है, and it is common. That is very common because everybody is afraid about the cardiac surgery. So I have to make them understand that with the type of medications that we have right now, the day before surgery we give that medications to them. So they are so calm and composed, they are not even aware of that they are going into the operation theater. And I always tell them, when you wake up, you will ask me, operation कब है sir? Operation हो गया? कब करने वाले हो? मैं उनको बोलता हूँ कि आपका ऑपरेशन तो 24 घंटे पहले हो गया. So that is the type of medications that we have right now. So there is no fear, no stress, no tension for the patients when they are wheeled in for the surgery. After surgery, now we have a very fast track anesthesia after the anesthesia. So within 5 to 6 hours, most of the patients are off ventilator. They start sitting on the chair the very next day. On second day or third post-operative day, they start walking in the ICU. They start walking in the lobby. My routine protocol in most of the patients is that on third post-operative day, patients should be walking at least 600 meters or so in the whole day. At the end of 5 to 6 days, when the patients are ready to discharge, by fifth or sixth post-operative day, they are already climbing stairs also. They are walking almost, I have a lobby of almost, I would say, 200 meters or 300 meters. They are taking 10 rounds in that lobby. So the rehabilitation is very aggressive. We go with a very aggressive rehabilitation program in this also. And very another big question, मेरे को दर्द होगा कि नहीं, मेरे को पेन होगा कि नहीं. So again, I would like to reassure everybody with the type of pain management that we have and the type of medications that are available on the shelf for taking care of the pain, I would say there is hardly any pain to any patients. It may be a minor pain, any small surgical pain sort of thing is there. But apart from that, patients are laughing and enjoying their life. My many patients on fourth, fifth day, they start playing carom board and playing cards and everything. So that is the type of recovery that we expect in the hospital. And after going at home, my target is by the end of 1 month, they should be back to their work. They should start their routine activities. With only few restrictions are there, they should not lift the heavy weights or driving and this 2-3 things only. But apart from that, after 1 month, they should be starting their routine activities. And in my young patients, I have done surgeries in the age group of 23 and 25 and 27, also bypass surgeries. I tell them to join gym after the 6 months. So they can start gymming also, and they should start gymming after the period of 6 months. So they can go for the very, I would say, the field sports also. They can do badminton, play badminton. They can go for swimming. They can do weightlifting. They can do dumbbells and everything. So as such, there is no limitation after the open heart surgery after 3 months or 6 months. Because this again, there is a myth कि अगर bypass surgery करा दिया तो हमारा energy level आधा हो जाएगा, हमारा शरीर आधा हो जाएगा. That is the biggest, I would say, the wrong belief that people have. And that is where I have to make them understand it is a wrong belief. Let me tell you, you were living with the disease till date. After bypass surgery or valve surgery, you are disease free. So you will be now living a normal life. On the contrary, your energy level becomes double. So this is, we in fact are very aggressive in the rehabilitation program. We force them to join the rehabilitation programs also.
Nice, nice. So we have a few questions in the audience, and I'll just probably take some of them right now before we continue. So one of the questions, sir, to you is, what precautions should we take after a valve replacement? अगर valve replacement हो गया, उसके बाद क्या करना पड़ेगा?
वाल्व रिप्लेसमेंट अगर सर्जरी हो जाती है तो अगर आपका उसमें 2 प्रकार के वाल्व्स होते हैं, एक मेटल का वाल्व आता है और एक टिश्यू वाल्व आता है. अगर आपके टिश्यू वाल्व लगा हुआ है तो आपको 3 महीने तक खून पतला करने की गोली लेनी पड़ेगी और उसका ब्लड का टेस्ट कराना पड़ेगा. उसके बाद आपको कोई ब्लड टेस्ट या कोई गोली की जरूरत नहीं पड़ेगी खून पतला करने की. तो ये कंपलसरी ध्यान रखना है. और अगर आपका मेटल का वाल्व डाला हुआ है तो मेटल के वाल्व में खून पतला करने की गोली जिंदगी भर लेनी पड़ेगी. खून पतला करने का जो टेस्ट है कि खून कितना पतला है वो देखने के लिए वो टेस्ट आपको हर रेगुलर इंटरवल पे कराना पड़ेगा. सो फॉर एग्जांपल, इफ यू आर अ डायबिटिक, you will check your blood sugars at regular interval. So similarly, इनका भी टेस्ट करना पड़ेगा. Third very important thing is, if you are on blood thinners, Then
Okay.
any new medications, आप कोई भी नई दवाई लेते हो तो वो ब्लड थिनर का जो रेशियो है वो चेंज हो जाएगा. So I always tell them कि whenever you're taking any new medication, third day get your PT-INR test done. Fourth important thing is if you get any infection in your body, whether it is a tooth decay or you have a pharyngitis or urinary tract infection or you have GI disturbance or diarrhea or vomiting, immediately consult a doctor and start with antibiotics. This is very important because if that bacteria crosses the endothelium and enters into the bloodstream, then chances are very high that bacteria may sit on the artificial valve and then you can get an endocarditis. So it is very important, if you get an infection, immediately treat the infection, consult a doctor so that the infection doesn't flare up and you don't get infection on your valve. From the dietary aspect, if you are on blood thinners like warfarin or acetone tablet, then you should avoid green leafy vegetable, tomato, and cabbage and cauliflower.
Got it. I think that's very useful, and I think I'm sure Hashmat and many people who are listening to this will have got quite a good information. Sir, another question that has come up is: should a patient undergo bypass or angioplasty? Is there a way to decide with a patient?
Is there a way? Sorry, is there a?
Sir, the patient is asking if one should have a bypass or an angioplasty. Is there any reason why you need to make a decision between the two, or is there no reason for us to be comparing? Is it quite clear that a patient who needs angioplasty has to get angioplasty, and a person who requires bypass needs to get bypass? Is there any overlap in that choice?
So I think so. The most common question and very important question, which everybody needs to understand. So see, there are three categories of patients wherein you need an intervention. One category of patient is if they are having a block in one artery or at the most two arteries, and there are single blocks, then there is no other option or no other alternative. Just get an angioplasty done. It's as simple. It is very simple. Or else, if you get a heart attack and you in ongoing heart attack, if you are going for an angiography, then definitely you need an angioplasty at that time. So this is one category of patient. Now there is a second category of patient wherein on angiography patient has three vessel disease. There is a blocks in all the three arteries. Patient is diabetic. Patient's heart function or ejection fraction is low. Or there is a calcium deposition in the arteries or diffuse disease arteries are there. Here again, there is no other alternative but only bypass surgery.
Okay.
There is no other alternative. So this two category of patients, wherever you go or wherever you take an opinion, you will get only one opinion.
Got it.
But there is a middle category of patient. Yeah, then there is a middle category of patient wherein there are blocks in two or three arteries, but blocks are very specific or small blocks. Patient may be borderline diabetic, patient's ejection fraction is fine. In that category of patients, you do have both options, that is angioplasty or a bypass surgery. Then in that case scenario, we look into the other issues of the patient, whether patient is obese, patient is compliant, whether he will take medication or not, whether how the lifestyle is, how complex the lesions are, how the calcified lesions are. So multiple other factors are taken into consideration. And then we take the call, or I would say the center that we have, we do take a call like a heart team approach, wherein myself and a cardiologist will combinedly see the thing, and then we take a call. Okay, for this patient, bypass is a better. For this patient, angioplasty is better. So again, very important thing is standalone centers will not give you the best options or ideas, but a center where you have both teams working together as a group, you will always get an ethical decision making or right choice that you need this angioplasty or bypass. So heart team approach has to be very important.
Thank you, sir. That is very, very well explained. I think our audience would definitely love that concept about where angioplasty is very clearly to be done, where bypass is very clearly to be done. But when there is a option where both options are available, a multidisciplinary team approach, discussing the patient and looking at the patient in overall, very, very useful. Thank you so much for that explanation. Another question that came up, I'm not sure about. Do pacemakers surgeries also come under your thing, sir, or does it now go to the cardiologist? Just for a clarification among people.
So pacemaker, initially cardiac surgeon used to do pacemaker implantation. Now there is a separate category of cardiologists. They are called EP specialist or electrophysiologist, cardiologist. It is super specialization. They take care of now the pacemaker section. So now pacemaker also, there is a huge range of pacemaker available now. So there is a whole separate section of cardiologists who deal with the pacemakers. But yeah, in tough situation or in situation wherein they are not able to put a pacemaker, they cannot do without cardiac surgery.
Thank you, sir. That is very useful. And now moving to the last section of today's show to understand, sir, as a cardiac surgeon, you already talked about your passion. You told us why you chose this profession and your vision to build a hospital which is comprehensive, giving all care at one under one roof. And you explained very well to our audience about what patients should expect. Are there any expectations from you, sir, as a surgeon, when a patient comes to you? Are there any expectations you, as a surgeon, that you have on the patient and in general? So it would be nice to know your side of the story also sometimes.
Yeah, I think so. Being a doctor, and each and every doctor, they do have one expectation from the patient perspective. You have to put in full trust into the doctor. See, any doctor, whoever is doing a treatment to that particular patient, he is going to put in 200% into that patient. Outcome may be negative or positive. Nobody knows it. And nothing is in our hand. We are just utilizing the medical science and the knowledge that we have to save the patient. But unfortunately, in present scenario, there is a lot of distrust, or I would say no trust on the medical fraternity. I think so that we all as the doctors are facing across India, and it has increased significantly. So my only I would say expectation is, whenever the patient comes to me, initially, if you want to consult 10 doctors, fine, you consult 10 doctors and then take a call. But once you take a call that I want to undergo treatment or surgery under one XYZ doctor, then put in 200% faith on him. He will do the best for you because he is there to save the people. We are all trained and I would say taught how to save people. Nobody is there to kill the patient. But it is ultimately the patient's destiny. We all try our level best to utilize this science for saving the patients. So I think so this is the only expectation that I have from the patient.
So very put. I think that's a very important message, not only for cardiac surgeons but across all doctors. That when a patient comes to a doctor, the doctor always has the intent to do the right thing for the patient. No doctor is ever trained to have a wrong intention for the patient. And I think that's exactly what you said. And yes, people have the choice to ask for opinion. There is a reason you can ask different kinds of options to you. And that's the reason why we already explained, and I think I'm repeating it again. When it comes to a particular type of care, like cardiac care, go to a center which can give you all the options and tell you comprehensively what can be done. And then you can make a choice. And once you make a choice, keep that trust in the doctor, because the doctor is always trying their best to help you out. I think we had a very great session today, Dr. Dhiren Shah. I'm sure these are 30 minutes of your time, which I'm sure you would have had more patients to attend to, or you would have, been saving more lives. But you've taken that much time out for us and to explain to the audience. Any closing remarks from you, sir, and for the audience listening to you?
I think so. Closing remark. See, I am a heart transplant surgeon also. So a lot of people they tell me, okay, you're a romantic surgeon because I fiddle with the heart. And they even tell me, okay, you're a guru because you change the heart also. But one message that I always give to everybody, and what I tell to everybody is, whatever you do in your life, whether it is a medical profession or IT profession or anything, put in your 200% of your work into that profession. Never do any half-hearted job. If you do 200% or if you put in efforts into that, then don't think about the rewards or don't think about what are the outcomes. You will always get a better outcomes. It is your commitment, your perseverance, and your endurance which always gives you the outcomes. Unfortunately, in present scenario, people are so unrest to achieve the name, fame, and money at a very fast age. I think so. That is what sometimes is a detrimental point. And I always tell the young surgeons and young people, only solution for your long-term happiness or goal-achieving life is just work hard and leave it to God. And I always believe in Bhagavad Gita's saying, "Karm karte raho, phal apne aap milta rahega."
Absolutely, sir. I think you've really put out a very strong message, and I love this message even from Sachin Tendulkar, whom we all respect as God of cricket, who says there are no shortcuts in life. I think exactly what you also put out here. You have to put your effort. The result is not in your hand, but at least you will always be happy that you've put the right effort forward. And I'm sure I wish you all the best, Dr. Dhiren Shah, in your efforts and your more dreams that will achieve. Sure, a lot more for you to explore as a cardiac surgeon as the science is evolving and technology is advancing. And we look forward to continuing to talk to you on this matters. And thank you so much for your time on spending on this. And I'm sure a lot many people will benefit from this show as they watch it on our YouTube channel. And we will continue to spread the awareness among people about what cardiac care is about and how cardiac surgeries are to be understood, and in what situations do they need to go to which center, and what kind of expectations that they can have. So thank you so much, Dr. Dhiren Shah, for your time, and all the best for your future and your vision, sir.
Thank you very much, Dr. Alvin, and I really appreciate for Numen for having this, giving this platform to discuss